The general guidelines to carry out medical equipment repair.
Steps to follow for medical equipment repair. Repairing medical equipment is a complex and specialized process that should be conducted by trained professionals to ensure safety and effectiveness. While I can provide you with a general overview of the steps involved in repairing medical equipment, please note that the specifics may vary depending on the type of equipment and the manufacturer's guidelines. Always follow proper protocols and consult with experts when dealing with medical equipment. Step number 1. Complaint documentation. Record the complaint or issue reported by the end user, including details such as symptoms, error messages, and any recent incidents. Step number 2. Initial assessment. Review the equipment's service history and perform a preliminary assessment to identify potential causes of the issue. Step number 3. Safety precautions. Ensure the safety of the equipment and the technician by following established safety protocols, such as disconnecting power sources and using appropriate personal protective equipment, PPE. Step number 4. Diagnostic testing. Conduct diagnostic tests and measurements to pinpoint the problem. This may involve using specialized tools and test equipment. Step number 5. Tests results records. Maintain detailed records of all tests, measurements, and observations throughout the troubleshooting process. Step number 6. Identify faulty components. Determine which components or parts are malfunctioning. This may require disassembling the equipment. Step number 7. Order replacement parts. If necessary, order replacement parts or components from authorized suppliers or manufacturers. Step number 8. Repair or replacement. Repair or replace the faulty components following manufacturer guidelines and industry best practices. Do not forget to add the part in inventory and register it with work order in the equipment management software. Step number 9. Quality control. Perform quality control checks to ensure the repaired equipment meets safety and performance standards. Step number 10. Calibration. Calibrate the equipment to ensure accuracy and reliability. Step number 11. Functional testing. Conduct functional tests to verify that the equipment operates correctly and safely. Step 12. Software updates. If applicable, update or reinstall the equipment's software to the latest version. Step 13. Cleaning and sanitization. Clean and sanitize the equipment, especially if it's used in a healthcare setting, to prevent contamination. Step 14. Documentation of repairs. Keep detailed records of all repairs, replacements, and adjustments made during the troubleshooting process. Step 15. User training. If necessary, provide training to end users or healthcare staff on the proper use of the repaired equipment. Step 16. Final inspection. Conduct a final inspection to ensure the equipment is in compliance with regulatory standards and manufacturer specifications. Step 17. Quality assurance. Implement quality assurance processes to guarantee the reliability and safety of the equipment. Step 18. Testing and validation. Perform validation tests to confirm that the equipment functions as expected and meets all required standards. Step 19. Documentation for end user. Provide documentation to the end user, including a report of the repairs performed, maintenance recommendations, and contact information for future support. Step 20. Follow-up and support. Offer ongoing support and follow-up with the end user to address any concerns or issues that may arise after the repair. Step 21. Regulatory compliance. Ensure that all regulatory and compliance requirements are met, including reporting any adverse events or incidents as necessary. Please note that repairing medical equipment should be carried out by trained technicians or professionals who are familiar with the specific equipment and any regulatory requirements in their region. All test equipment and analyzers should be calibrated and certified by third party and must adhere the local and international standards. Safety and accuracy are paramount in the healthcare industry. These guidelines are not replacement of technical and service manuals of the equipment. For best results, equipment manufacturer must be contacted. Thank you for watching. Have a good day and don't forget to subscribe.